You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, new treatment options for people that are suffering with gum disease. With us, we have the founder of Millennium Dental Technologies, Dr. Gregg. Dr. Gregg, welcome to the program.
Thank you, Randy. Good to be with you.
All right, now before we get into today's topic, for people that don't know you, I always feel like just about every dentist knows who you are. Tell us a little bit about, how your involvement with the company. I guess you co-founded.
Yes.
Tell me about that.
I'm a general dentist.
Okay.
I graduated from Georgetown, and I am not a periodontist, but I did develop a protocol along with Dr. McCarthy. We formed a company called Millennium Dental Technologies, of which I'm president, and Dr. McCarthy is chief technology officer. Together, we developed the LANAP protocol for treating gum disease in a patient-friendly and tissue-preserving way.
Okay.
And we also developed the Paralaze MVP7, which is the device that performs the LANAP protocol.
Okay, good. Now we should mention, by the way, that the LANAP has become somewhat mainstream. I guess you're just about to reach critical mass. Elaborate on that.
Yeah, and if you look at any technology that's being adopted, say smartphones or iPads, it takes a while for the population and the curve to start to grow and accelerate. Well, if you look at our growth with periodontists specifically, at around 14% of the AAP, we're starting to reach that acceleration point where it's driven by the existing market of customers and not through advertising and marketing. It's self-generating.
Is that right? Now you have the biggest name periodontists now on your site that are using this and that say they would never do it any other way. Is that true?
Absolutely. We have some icon
Give me some
periodontists.
names. Icon periodontists.
Icon periodontists. Maurice Salama.
Okay.
Out of Atlanta. David Garber, also out of Atlanta. We have 5 trustees of the AAP, which is a conservative group. And these are the opinion leaders within the organization. And every week we add another named periodontist. Stephen Brown, outstanding periodontist.
I've interviewed him,
Yes.
Temple University.
Yeah.
You know, one of the things that I'll hear, especially going into this interview, is that, the problem is with laser when treating gum disease is there's not a lot, or growing bone or building bone, not a lot of literature to back it up, maybe a few studies. And I guess you guys have over 300 or 365 published articles, patient stories in 6 different peer-reviewed journals.
That's correct.
Okay.
In 6 peer-reviewed published journals, there are 365 patients that have had their data examined. Some of them have been very rigorous scientific human histology studies. Some have been retrospective studies, nonetheless published in peer-reviewed refereed journals. You can't look at 6 and say it's a small sampling, because the very first study for guided tissue regeneration was 1 study on 1 tooth, and that launched an entire clinical protocol. We've got far more data than that over 21 years, and those that say there's not enough, they just haven't looked.
Okay.
We need to help them look.
So general dentists are using this. In fact, one of my people that I've had on my program in Arizona gets about 40 or 60 new patients a month doing this.
Yes.
Loves it. I interviewed Dr. Yetta McCullum, and one of the things she says, and I love this story. She said, because I'm skeptical, and I'm not trying to side with you on this, but she said she liked one of the educators, the speakers on a surgical procedure for gum disease. She said, when I went to the procedure, she's been using it for 4 years, the LANAP. She said, I looked at it and it was like, this is ancient history. I can't believe people are still cutting. And I said, well, do you ever do it? She said, rarely, maybe once a year. I think she said twice a year at the most. And she's a high volume practice.
Yeah.
Do you hear that from periodontists that they say,
Absolutely.
I don't have to do surgery anymore?
Absolutely, all the time.
Really?
The periodontists that have acquired the LANAP training and are practicing LANAP, absolutely. Ray Yuckna, another icon dentist out of LSU, said that he no longer uses a blade and hasn't for 6 years for periodontitis treatment.
Okay. So it is mainstream. I mean, that part of it. Now, what are the frequently asked questions you have? Because I invited you on the program today.
Yeah.
This is really not for the public. It's for the doctors.
Correct.
So what are the frequently asked questions? And maybe I'll have you on the program to kind of dispel some myths and address some of these questions like, does it really, help grow bone?
Right.
Is there any evidence to this? And some of the other things.
Well,
So I'll let you go from here.
Yeah, I mean, some of the things that we hear are, well, I can do that with my $1.50 scalpel blade. Okay, fine. And then what are you going to do for the patient that doesn't come back because they didn't like how it felt afterwards?
Okay.
That's a problem. Whether you have the golden scalpel blade or not, the patient doesn't see it that way. And they vote with their bodies, and they don't come back. And anybody who's thinking honestly about this will have to do some self-reflection, because the statistics are there.
Okay.
They just don't come back. About 2/3 of them don't accept treatment.
I'm going to cut in for just a moment, and I can't hold myself back here, but these doctors are increasing their bottom lines.
Yes.
They're cutting costs.
Yes.
And for those that want to work less, right?
Yes, all of
They're
that.
able to do that. I mean, what you guys could do in 1 to 3 visits, what in traditional therapy may take 9 visits.
Correct.
Is that correct?
Yeah. The conventional approach for treating gum disease, 4 quadrants of pre-surgical scaling and root planing, 4 quadrants of surgery, and then a post-op or 2, versus 2 quadrants of treatment, 1 post-op. Which would you rather go through?
Okay.
Which would you rather put yourself through? And if you want to do 9 visits, how about treating more patients in that time?
Okay.
Or not? You have the choice.
But your guy, back to the scalpel thing, okay?
Yeah.
He said for $1.50 or whatever he said with his scalpel,
Yeah.
and your laser is not cheap.
No.
So how soon could they get like an ROI? I mean, how long does it take to?
1 patient. Just 1.
Okay, tell me about that.
Well,
What do you mean?
lease payments are, say, $1,700 a month.
Right.
Well,
okay.
yeah, let's do. What is your fee to do 1/2 of surgery, 1/2 of the mouth surgery? It's easily $1,700 unless you're,
Okay.
somewhere out in the boondocks. Then it might take another quadrant, but your very first patient will be your profit, because you'll pay for the cost, and then the other side of the mouth will be pure profit.
Logically, that makes sense.
Yes.
Do your doctors that are using this, would they agree with that? Would they say, yeah,
Absolutely.
I'm making money immediately on this?
Our doctors are paying off their lasers and the protocol training in 6 to 9 months, routinely.
Now, you're the only laser company, by the way. Is this true also, that you guys require before you buy the laser, they have to go through the training?
Yes. We're the only company in the world. No other company before us or since us has required training as a requirement of receiving your laser. You have to go through 3 days of training. And then once you've passed the curriculum proficiencies, then we ship the laser. And then there's 2 more training events that come along, evolutions we call them, at 6 months and at 12 months, to really cement the lessons learned and to help answer their questions that we've learned come up over time.
Okay, now I know you brought slides, but you have a pin on your lapel.
Yes,
we won't
I do.
zoom in on that, but
Yeah.
you told me what it is.
Yes, it's a no cut, no sew, no fear pin that's not to upset periodontists.
Do they get upset about it?
Sometimes they get very animated and they say that's an insult to our profession.
Really?
Absolutely, and I just think that's so silly. I should still use a blade. I use blades to retract tissue, to move tissue, but not for treating periodontitis.
Okay.
And this is really good for the consumer, because that's who it's for, the public, because they're the ones that need the message that there is a no cut, no sew, no fear option. And it works really good when we're traveling with flight attendants. They say, what is that? I need that. My husband needs that.
You tell the flight attendant, you know those puffy gums you have right there?
And I don't do that. They tend to they're curious. They want
right.
to know. They're very good observing.
Now, what about people that say, but Randy, because they're always trying to protect me, because I don't know who's telling the truth sometimes, right? And they say, but Randy, here's the problem. You could burn a root with these lasers. They don't like to tell you that.
Yeah.
What's your response to that?
We've done 2 human histology studies that show there's absolutely no damage to the root surface. And the author of one study that published that back in 1992 has now distanced himself from that study, as has the second author on that paper, who is a customer.
But
of
is that
ours.
also in the context where you could do the same thing with a scalpel?
Absolutely,
Right.
or a high-speed handpiece.
So if they go through your training program, obviously, if they're doing it in the right protocols,
Absolutely.
should not be an issue.
I can do damage with anything.
All right. And one thing we should mention, and I want you to go to your slides, but I spoke for 7 hours at the North American Society of Periodontics. And I said, how many people are using the laser, the LANAP laser, in this particular case? And it was about 30% were using it, and the other ones weren't using it. They didn't believe in it. And I picked one guy. I said, Dr. Stephen Brown, could you stand up for a second? Could you practice any other way, knowing what you know and seeing what you've seen? And he turned around and he said, no. This is the best thing I've ever done. Exact quote.
Well, we no longer amputate legs for infections like we did in the Civil War.
Okay.
Why are we amputating gums for infections? It doesn't make sense.
That's not some kind of an overstatement, though?
Not at all.
You believe that? Okay, good.
Absolutely.
Good. And we'll stay positive. Okay, so what'd you bring here?
Brought
This
some
is
of
a
the
case for why this is valid. It's real science, 365
Yep.
published patients in peer-reviewed stuff. So what are we looking at there?
What we're looking at here is something unique in wound healing, and that is to get the 3 critical elements of regeneration, which is the new root coating cementum, which is the periodontal ligament, and the new bone. And what this is showing us is those elements in place at the histologic level in a manner I've never seen before.
And this is a new report,
It's
new published.
This is in pre-publication, and it will soon be out.
Okay. What else do you have?
Well, a little bit more on that same study. What we're looking at here is just a little lower resolution of the root, and the dark brown around the root is new bone.
Okay, so dentists, when they see this, obviously I don't know what I'm looking at.
they have to explain
but they know what they're looking at?
They need a little help. But this one just shows that same box magnified. And what we're looking at here, again, is the new connective tissue, the new root coating of the cementum with fibers from the connective tissue, Sharpie's fibers, deeply embedded, so it's not a coating or a surface effect. It's a deep connective tissue. That makes it a durable attachment instead of something that tears open very easily, like long junctional epithelium.
Okay. What's the toughest thing for dentists, general dentists, periodontists to grasp here or believe?
I think the toughest thing is how does it work? And what they're not thinking about is simply wound healing 101. Clean it, disinfect it, close it, keep it closed. But closing it is the hardest thing to do in periodontics because we have a mouth that's a tropical forest and we're swimming around in a swamp and our teeth and our roots get exposed to that. Well, we figured out a way to heat the blood during the procedure with the laser such that it creates a rubber gasket seal and it keeps debris and bacteria out, and then the wound heals from the bottom up just like a root canal would heal. Nothing new. Same idea, just a different way to approach creating a membrane that creates fibronectin, which creates the closed system.
Now you get this done, by the way. We've talked. Future of dentistry, you think the hygiene department of the dentist will go around the mouth, even with healthy gums, go around the mouth.
That's what I'm doing today. That's what I'm doing today.
Do you do it?
In my mouth, I want my hygienist to use a laser at a lower setting, no anesthetic, to disinfect my gums, alter the biofilm, change the biology and the ecology, if you will, that's going on in there, but also desensitizes my teeth and my gums so when she does start her cleaning and calculus removal, I don't hurt for 2 days. So my tissue's not tender and singing to me.
And, I'm a marketing guy, you know that. And one of the things that the periodontists are saying is they're getting referrals.
Yes.
From their internal marketing is picked up because the patients now.
Yes. Yeah.
You hear a lot of that.
Oh, to a periodontist. I'm seeing more referrals from family, friends, and coworkers of the patients I treat than I ever saw before. I mean, we're talking not just a factor of 2 or 3, but just 90% change, almost 100% difference, other than getting a referral from a GP. And nothing wrong with that.
I have a buddy of mine, smart guy. He calls me on the phone and he says, Randy, I'm not an early adopter. And you know me, Randy. He says, if there was something that would help my patients, periodontists, I would use it.
Yeah.
But the science, I'm not sure is there. And I'm paraphrasing just that last little part. He said something like that. Yeah. I don't think there's enough published articles, studies, but it's there.
It's there, and it kind of reminds me of the cartoon where the Roman army is getting ready to go into battle, and there's a guy with a machine gun, and the general says, "Not now. I don't have time for this. I've got a war to fight."
Yeah, good. Okay.
Hey, this is a technology that you haven't seriously investigated for you to make those statements, because a lot of those statements are really not accurate as far as the science goes compared to what you're using now and doing now, or accurate for the technology and how we're using it and how the results are. So it's kind of a closed eye, closed ear, closed mouth approach to.
I spoke to a female periodontist in Orange County. She goes, Randy, treating gum disease is not a sexy procedure.
No.
But now it is for me. I have fun.
Yes.
I never wanted to call the patient the next day. No. Now I do.
Absolutely.
Okay.
It's one of the most exciting things to do. We encourage the doctors that come through training to call your patients that evening and enjoy the conversation. You will be thrilled.
But you've treated thousands yourself.
Thousands.
Gone around their mouth.
Yes.
Are you ever surprised with the results?
Yes, from time to time. But now, after all these years, I have a different horizon that I'm looking at than those that are just starting out. I get to see my 15-year results, my 20-year results.
And what are you seeing?
I'm seeing stability over time.
Stability defined as bone stays?
The bone stays. And if you think about it, if you can create the environment for bone regeneration by not adding material in, why can't you keep it? But you got to clean it, close it, disinfect it, keep it closed. Disinfect it and keep it closed.
But your bone's staying. Is that because you're treating them every 6 months or once a year?
No, we don't retreat them again. We maintain them. We do periodontal maintenance, but we don't do surgery again. My dad's a physician. He told me, do surgery once. Wounds heal best treated well once.
Okay.
Don't go in there and keep picking at it, and dentists love to pick. They love to pick at the pocket, pick at the tooth. Treat it like a wound, like the rest of the body. I don't want somebody to remove my splinter in 4 equal parts. I want it out one time and allow the wound to close, not go back in 3 more times and pick at it some more. That creates a chronic wound site. That's what's happening in perio. We have the wrong philosophy and approach to treating gum disease.
All right.
And
you're out to change that.
Yes, we're out to change the standard of care for how gum disease is treated. And it's not to pick at it. It's to treat the wound well once. And then we get regeneration versus scar tissue formation. And that's anywhere in the body. We know what keloids are. They're incomplete organization of our wound response.
Okay.
You can get keloids of that sort of analogy in and around the teeth by picking at them all the time. Quit picking at them. Treat them and treat them well and do it once and let them heal.
Okay.
Enjoy the results.
Now, the largest, integrative medicine conferences in the world, A4M, the medical doctors are all talking about this. I mean, they have lectures about this, and they're also big on lasers. They say, this chronic infection leaking into the body,
yes.
and some of the guys are trying to explain to me, some of these medical doctors, that, Randy, the problem with some of the cutting procedures, you've got a broken mucosal barrier or an open wound.
Exactly.
This stuff's going into the into the body. You've got a compromised immune system, so now you're going to have a bunch of problems.
Yeah, yeah.
These are the things you guys.
Oh, I went to the ER to take a patient who walked in my door with a massive infection I knew was severe. It was going to be a real problem. And the emergency room physician even said, "Oh, you use lasers to treat gum disease? Well, we all know that gum disease contributes to heart attack and strokes and preterm babies." And I was very surprised to hear that from a physician. But yeah, you think about sealing the mucosal wound. What if you're doing a graft, not treating periodontitis? Wouldn't you want to, after you use your blade and just before you're going to suture it down into place, you seal off the wound edges to get hemostasis, seal off nerve endings, and get a better closure of that wound? I believe I'm doing a better service for my patients by using state-of-the-art technology. I use a smartphone these days. I don't use a dial-up. I'm sorry. I don't even use the phone at my home. It's there strictly for messages.
A lot of the doctors obviously have to justify this cost. And you're saying, if you do 2 of these a month because of the laser, you'll get your money back. It'll pay for the lease payment. Is that right?
1 patient a month.
All right.
That's hard to believe. Okay, 2. With 85% of the population, according to the U.S. Surgeon General, having some form of gum disease, there's not enough disease out there? Yeah, there is.
Okay, I pressed Dr. Bloor. I said, I want the numbers. She says that we've had people that have done 80 a year, doctors that have done 80 surgeries a year, and now they've moved it up to 350.
That's correct. I know that doctor.
A year.
I know one of those.
And so you guys have stats and charts about increased productivity because of this. Because of patient compliance, right? They're going for treatment.
If you had a choice between getting, your cornea replaced versus LASIK, which would you choose? Both work.
Okay.
I think I'd rather not have the blade. I think I'd rather have the laser procedure because it's less invasive, it's more precise, it's tissue targeted.
All right.
I'm sorry.
So 365 published peer-reviewed publications, not to mention, you have close to 2,000 dentists that have these lasers.
Yes,
I mean,
that's
if they
correct.
presented their information, are you hearing things like bone is regrowing, gums are getting better?
Not only that, we are seeing profound bone regrowth around failing implants. I was astonished how many of our periodontists are sending us cases of, wow, look at this. You taught us that we could do this. You gave us the correct parameters. Now look what we're doing with what you taught us in numbers I never saw before, because I didn't treat a lot of failing implants. Periodontists have that in their domain for the large part. They're treating a lot of periimplantitis and regrowing substantial bone. And you think about that. There is no way you can properly or acceptably treat a failing implant. As soon as you lay a flap, you lose everything. So you have to take the implant out, graft it, wait for a period of time in order to stick another implant in. Or you can spend about 2 to 3 minutes to LANAP it or to LAPIP it, if we were going to use the proper term, and sit back and watch bone grow.
Could an expert, but I'm definitely not an expert at all on this, could somebody argue with what you just said?
Sure.
And what would their argument be? Somebody that just heard that last little segment.
Oh, there's no science to support it. There's no data. There's no evidence. There's no literature.
There is?
There is, not for this particular application. However, there is showing in J. Perio using an Nd:YAG laser of the type we use around implants to destroy LPS.
And you could put them on the phone with periodontists that would say, yeah, I've seen it myself.
I could send them a lot of cases.
Is that right?
Oh, yeah.
Okay, good,
There's a lot of material out there.
For the sake of time, you have more photos. Let's take a look.
I think this is the sine qua non of what we're supposed to be doing.
Sine qua non?
Sine qua non.
Okay.
Ichiban, Toxon, the best. All right.
Okay, all right.
It's the best we can do for our patients. This patient it got a great result. That is a pre-op. Doesn't look very pretty. And here's immediate post-op. And for a lot of people, like, well, nothing was done. Thank you. Wounds heal best treated well once, but not mutilated well.
Okay.
You don't want to mutilate tissue. You want to look like you left no fingerprints behind, like the ninja, in and out. Do your job.
And so this is a periodontist dream, by the way, to do some tissue grafting to clean that up?
Well, later on. You're right on the right track, because this patient refused professional care for 20 years. She needed periodontitis surgery. She refused, but when she heard about the laser opportunity, she came in, we got her gums healthy, and now she needs some grafting to be done.
Okay, but by the way, and I'll make sure my editors, so put that side by side. So the gums grew up. I mean, they grew a little bit there? That's no surgery, no...
This is LANAPing. There was some... there are some changes in the tissue.
No tissue grafting on this particular photo?
Nothing, but we'll need some later on. And this patient now has an opportunity, and the dentist, to realize additional benefits in terms of treatments. We're getting more patients I'm referring to my periodontist for connective tissue grafts.
But could anybody say that's not typical, Randy?
Well, you know what they would say? They would say, I can do that with my scalers.
Okay.
And you say, great, the patient won't let you. Now what's your options? We have a responsibility, I believe, to offer things to the public, because that's evidence-based dentistry, by the way.
All right.
Evidence-based dentistry isn't just what the literature says. Evidence-based dentistry is a three-legged stool. It's what the science says, it's what the patient's needs and wants are, and it's the doctor's skill and expertise. And we have a responsibility to up our skill and expertise and technology in order to meet the needs of the patient consistent with the science. That's evidence-based dentistry. And when you say, oh, there's no science, then you're only looking at one element of the evidence-based triad. And patients need to be thought about first.
Okay.
And that's my passion. My dad...
The general dentist must love this, by the way. I mean, for them, it's really good. For the periodontist, depending on who you talk to, they think it's life-changing, career-changing.
It is career-changing. Bill Rogers in the South came out of retirement and funded his 401k after the stock bomb, and now he's had enough money. He's finally retired, and he's a happy guy. But without that ability at a retirement age to have a body-sparing, tissue back-sparing experience, because LANAP is an easier procedure to do.
Who's allowed to do this, by the way? Does it has to be
just dentists. Hygienists are not allowed to do this. It's a surgical procedure, and that needs to be emphasized. But you know what? Something about the GPs. Not all GPs want to treat perio, but a lot of them are doing it because the periodontist won't. And when the periodontist, and this is some from our data, when periodontists start treating patients with LANAP, the GPs, we see a decline in their LANAP activity because they refer to the specialist because they'd rather do other things, cosmetic things, bridges, veneers and things. So it's really a fascinating
Insurance?
dichotomy.
What about insurance?
What about it?
Is it covering LANAP at all?
Absolutely, it's covering it. In fact,
it is?
Absolutely. In fact, I'm talking with the...
Same percentage as the other procedure?
Absolutely. In fact, one of the largest carriers and I are talking right now about a specific narrative and a specific sticker to put on the claim forms such that that our doctors doing LANAP will be recognized as certified and trained LANAPers so that they will be paid for conventional fees of the surgical nature.
Okay. LANAPers, you call them?
Well, just affectionately, yeah.
You're calling them. And what about other lasers? Can that do the LANAP protocol? I mean, can they mimic it?
Most can't. And let me just say that the Paralase is a wavelength specific device.
Okay.
It's one wavelength in the near infrared, 1064 to be specific. Most lasers out there are not 1064. We're the only company in the United States that manufactures a 1064 nanometer pulsed NDA. The only company.
Okay.
And all of our parts and pieces are manufactured in the USA. We do no outsourcing.
And you're big on, I was reading Steve Jobs' book, and he was an attention to detail guy. I mean, you're one of the first guys that you made it different colors.
Yeah.
Right?
Yeah, we're the first company.
Office. Can you still do that? Could you order a specific color?
Yeah, you could order it with flames on it if you want. We have several.
Are there anybody with flames on their?
I have one.
Oh, really?
Yellow flames. Yeah, a yellow painted laser with red flames going down the side. I have not yet added spinners on the wheels, but I'm thinking about it. That was a patient suggestion. And also Mike Colleran, who has a black painted laser with blue smoke flames going down the sides. Very sexy, very attractive. It's a talking piece for the patients too when they come in.
Good. Okay, so the main thing is it works.
It works.
You have over 365 of these published, and more to follow.
More to follow.
And because we're out of time, are there any other slides that you have to show?
No, we're good.
You're good. You're good. So final message. If somebody wants to get involved, can they talk to other people that are doing it?
Absolutely. And you know what?
Is there anything we haven't talked about, by the way?
Yeah, there is. There's something very important. We're the only company that has ever, and still to this day, offers a 6-month guarantee on the clinical results. Think about it.
What does that mean? Tell me.
That means if you don't get the results that we're showing, we'll buy it back.
Is that right?
Absolutely.
Have you, and does that happen?
Twice in 12 years.
Interesting.
Out of 1,500 patients, doctors.
Okay, good.
Yeah.
And could you give me a recap? Give me your case why the periodontist should do this. Give me your case why the general dentist should do this.
For the patient.
Should get a LANAP.
For the patients. There is no better reason. Get it for the patients, and we'll show you how to make it work for your particular practice style, but we'll also show you how to make it work in terms of additional procedures that you can complement it with. But you'll receive more business, more referrals as a specialist, and GPs, you'll realize more procedures that you can do as a generalist.
And the cosmetic dentists, are they jumping on this?
They're using other lasers, but they could be taking care of the foundation with LANAP and then also the cosmetic results, because a lot of porcelain is being put on damaged bone, infected bone, and I've seen some of that too. And when you resolve some of that inflammation, you get some shrinkage, and it shows the margins of those nice cosmetic crowns.
And you do this every day, by the way? I mean, you're a practicing dentist.
Yes, 4 days a week still.
And you, I mean, every day goes by, you do the laser? Every day?
4 days a week.
4 days a week.
I got to take Friday off. I got to get together.
And things like bleeding gums, I mean,
they don't exist.
Really?
It is not allowed.
That goes away quickly?
It's the first symptom that goes away, believe it or not. And that's what's so dramatic and why we can offer that 6-month return guarantee, because it only is in with the first week of the treating a patient that they see, wow, I've never seen gums this healthy in a week. What does it look like in 2 weeks? And when they see it in 6 months, they go, I can't turn this thing in.
Interesting.
Fascinating.
I had a periodontist. I was trying to figure, knowing you were coming on the show, Dr. Yetta McCullum, and I said, well, why is it then? Because I don't, if you guys are telling the truth, it seems like everybody should do this, okay? Yeah. But I said, why would a periodontist be so reluctant to do this? Or she goes, because we're so used to surgery. And when you have to hear that you're no longer
Yes.
doing this. That was her take.
Yeah. It's.
What's your take? Why aren't they
I
all
think
doing
that's true. I think part of that is true. I think
There's science people, obviously.
Yeah. Well, part of their identity, like my dad as a surgeon, is their blade, and they identify with that. My father was friends with the physician who did the first knee arthroscopy in North America. They kicked him out of my dad's hospital because it was heresy.
Okay.
And now it's the standard of care for certain types of knee injuries. Wow, what happened between this guy's a quack and standard of care? Same kind of thing.
Do you have people that have eaten their words? That means because you're the co-owner of the
yeah.
company, you could probably give these away to a few big name guys.
We never do that.
Okay,
we value it that much.
But do you have people that have literally eaten their words and just said, look,
Yeah.
Really?
I could name one, and I don't think he would be ashamed, but he said that he actually, and I've heard this from several, wrote letters to all of his referring dentists why LANAP is not a good thing to do. And then within the year, he was on board and practicing, came up to me at an event and says, I have to apologize. I just didn't know. And I said, didn't know what? He says, our professional specialty organization has given us misinformation or not complete information. I looked to them to give us the facts, and they let me down. I should have done more due diligence, found out more information than I did at first. I finally did it thanks to one of your reps who pointed me in the direction, and I couldn't be happier, and my patients are winning, and that's what it should be about. All about the patients.
Good. I want to thank you so much for coming, for taking the interview.
Absolutely.
Great stuff.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you'd like to see this interview again, I'm sure it'll be on their website and our website. You can go on wellnesshour.com and just put in LANAP, and you'll find it there. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.